I'm Dr. Gajanan Dhanipkar, practicing homeopathy for last 22 years in and around Mumbai, and I'm going to speak to you about a homeopathic approach in tuberculosis. This is a good question because though the disease has common symptoms, and we also see at the common symptoms of tuberculosis the way modern medicine sees, like for example progressive loss of weight, the fever, and the affection of the particular organ because of the tubercular bacilli. Apart from this, homeopathy not only sees the affection, but we also see the affection of the person, how the person has reacted to as a whole to the condition, his emotional state, his physical state, his aggravations, his ameliorations, and the seat of the disease. When we see this thing together, the thing that we generally conclude on is the individuality, how this individual responded to the affection of tuberculosis apart from the infection as per se. By doing this, we get an edge and have a deeper understanding and have remedies which work much deeper to get the disease under control. When the treatment starts, all patients first want is relief from the symptoms that they are suffering from. So all patients will first feel that their fever has to go down, the appetite which has gone down has to come up, the weight loss which they are going through that has to stop. This is the first thing which a patient should get and should happen to the patient as soon as the treatment starts. This is one thing which homeopathy surely helps to achieve. Apart from that, a general well-being starts. The feeling of being better, the moods, the emotions, those things also start returning back to normal in a much healthier way. Second thing is, when you are on treatment, many a times you are suffering from the effects of the medicines that you are taking. This effects also withers off. So when you are treating cases with homeopathy, you see minimum suffering and maximum relief that comes to the patient first when you are treating with homeopathy. This can never be ruled out because when we are practicing with the modern day medicine, we always get patients which are already on treatment with homeopathy, allopathic or the modern medicines. And nowadays when there is a new strain, that is the MDR, the multi-drug resistant tuberculosis, that is what we see as a challenge to the medical fraternity as such. Here homeopathy has a lot of things to offer for those patients who have not got relief with the standard line of treatment for MDR. When we see the patient differently, the way I told you earlier, we can get slightly additional information out of the patient and the individuality distinct compared to what we get when you are treating tuberculosis on a protocol basis. So when we are doing this, the remedies that we find helps in first reducing the effects the patient is suffering because of the medicines. And if the patient is not responding, and when you give homeopathy together with allopathy, then the improvement is generally much better and faster. And this is our experience now in our day-to-day practice, that such patients have done well when they are being treated in conjunction with allopathy. Since I told you we have a lot of situations where multi-drug resistant tuberculosis are coming to us, I can share a few of my experiences. There was a young boy who was around maybe 18-20 years of age, and he developed tuberculosis 3 years because of irregular treatment that he was taking for tuberculosis, and then he goes into a drug resistant tuberculosis. When he came to me, he had fever for 6 months, not responding when on allopathic treatment itself. And when we started the treatment, he came with abscesses, recurrent abscesses and fevers. When we took his case and started homeopathic treatment for him, the first change that we saw is that within a month or so, the episodes of fever had completely reduced. He started gaining appetite. The weight which was going down started remaining constant. Over a few months, again the abscesses returned, and then over a few months they subsided back. Over a period of a year, with allopathic treatment and homeopathic treatment continues together, which the patient was deteriorating, the patient stabilized, and the x-rays and the sputum reports came back to normal. The patient lived healthily after that. Another case I am telling you was a case of pleural effusion where the patient was completely normal, suddenly developed effusion because of maybe some immune response, and was diagnosed having tuberculosis. And here the case taking was completely homeopathic, where we chose a remedy according to the organ affected, the site affected, and the individuality of the person, and the effusion got minimized and the patient was relieved within few months after treatment. Another case I would like to share with you is the case of tuberculoma of the brain, where the patient came to us for convulsions because of the tuberculoma which she had in her past because of tuberculosis, and she was being treated for convulsions which the patient was responding only partially. After taking the history and the past history of tuberculosis, when we considered it her past history of tuberculosis and gave treatment for tuberculosis along with the convulsions, the tuberculoma disappeared and the convulsions stopped, and all of the allopathic medicines were discontinued afterwards, and the patient was healthy hereafter. There are many cases like this, and most of the cases that we treat nowadays are those of drug resistant tuberculosis, where patient is having tuberculosis treatment not responding to allopathy, and we come in there and then get the things back to normal. What I feel is, in such cases, when there is a crisis and if the patient is on allopathy, you can have homeopathic treatment in conjunction to get the patient out much faster and in a healthier way. So we have a lot of work to do together in cases of tuberculosis per se. Earlier we used to always think 10 years that tuberculosis is not there in our country, but now if you see, for the present scenario, we all homeopaths and allopaths should think together that we require to join hands in treatment of tuberculosis. In cases of treating tuberculosis, homeopathic approach always adds an edge towards the well-being of the patient. So considering both the treatment together also will help the mankind to get out of this dreaded disease much faster. And it is a healthier way to get out because it minimizes the side effects and the well-being returns faster. So I feel that working for tuberculosis, we all need to join hands to fight this dreaded disease.